am Dr. Jenna LeCount-Heinley, and I am the CEO of HARC, which stands for Health Assessment and Research for Communities. This fabulous event is funded by the gas company, and we are so thankful to them. Deborah McGarry is out in the lobby, so be sure to say thank you to her if you enjoy your evening. We'd also like to thank UCR for hosting the venue and for hosting the parking tonight. So tonight we wanted to talk about air quality and health, and our health specifically here in our Coachella Valley, and practical things that you can do to improve your health. So first I want to tell you a little bit about HARC and how we ended up being the ones who are here. We are a nonprofit organization that is located actually directly across from the other building here on UCR Palm Desert campus. We specialize in research and evaluation, so we're a little bit different from your typical nonprofit. Rather than doing direct services, we provide the research and evaluation that other nonprofits need to do their work well. So there's two main parts of what we do. We do a huge survey of the health of the Coachella Valley every 3 years and give that back out to the community free of charge. That lets our community know what are the pressing health issues and have good hard data to get the funds that they need to do their work. We also, the other half of what we do is produce customized research and evaluation, so things like program evaluations, analysis of data, etc. On the whole, we are committed to improving community health and wellness and to educating and connecting people to the resources that they need. And so that's where we came from here. And the gas company said that they are also interested in public outreach and education, and this event was born. So I'm not going to talk very much because we have some fabulous panelists that are much more experts in this than I am, and I want you to hear from them rather than from me. But the ties between air quality and health aren't always really well established. Often, you don't really think of the environment and of your health at the same time. Am I too quiet? Okay. Sorry about that. Ooh, now I'm loud. Air pollution is caused by particulates in the air. And that can be something like ash from a forest fire. It can be something like pollen, if any of you have allergies. It can be vehicle exhaust, which I think is what we typically think of when we think of pollution. And that really is detrimental to everyone's health. But it's especially detrimental to people with respiratory diseases. And so today, I have experts both in environmental aspects and in the health aspect to sort of tell you how these tie together and what the relationship is between air quality and health, as well as practical things that you can do to ensure that you have the best possible health you can. So one of the things that we should be concerned about is the prevalence of respiratory disease in the Coachella Valley. I don't want this to be a data-heavy presentation, but I'm a data nerd, so I never do a presentation without some data. And our 2013 survey found that 17.6% of adults in our Coachella Valley have been diagnosed with a respiratory disease, including asthma, which is our most prevalent. And 10.7% of our kids have been diagnosed with some kind of respiratory disease. So for these individuals especially, this is a really, really touchy issue. And for all of us who ever breathe either indoor or outdoor air, it really is a critical issue to how can you improve your health by improving the air around you. So I want to invite up our first speaker, Dr. Domogowski, and he is the Assistant Professor of Clinical Teaching at UCR School of Medicine, and he is the Associate Program Director for our very own UCR Family Medicine Residency here in the desert. So, Dr. Domogowski?
Can everyone hear me? All right. So thank you once again for the warm welcome. So I'm actually a family physician by trade. I'm a primary care doctor. I'm not a lung specialist by any means, but in my practice, we see a lot of respiratory disease. we see a lot here in the Coachella Valley, so I'm very happy to be here tonight to talk about it. So respiratory illness, comes in different flavors. Asthma is one that we're all very familiar with. If you don't have asthma, you probably can, you know somebody in your family or a close friend that has it. You see folks that suffer from asthma disease. We'll oftentimes see them in our clinics, in our emergency rooms, and sometimes when it's really severe in our hospitals. Another type of respiratory disease that we'll see a lot is COPD. So, and a lot of times people ask, what's the difference there? So, with asthma, it's a reversible obstruction in the lungs. So, in that picture there, that's an airway tube. You can see how it's kind of swollen and constricted down. With asthmatics, they can use an inhaler, and that will reverse the obstruction and allow the air to get through. With someone with COPD, it's chronic obstruction. So that means they can use inhalers, they may help a little bit, but by and large, that obstruction is permanent, and oftentimes that's permanent lung disease. So just so, because I'm in adult education, I teach young doctors. I like to keep talks interactive, so I want everybody, while you're here in your seats, I want you to take a nice deep breath for me and hold it. All right? Now, I want you to take even deeper of a breath. Nope, hold it. This is just a tiny example of what it's like to live with COPD. Let it out. So folks with COPD, it's not so hard to get the air in, it's getting the air out that's so difficult, and that's the difference. Sometimes patients may come in and initially it's just suffering from something like bronchitis, which is a treatable condition that happens once. But when it comes more and more often, they typically will get diagnosed with this condition. Emphysema is another form of this that the patient may be diagnosed with. Asthma and COPD aren't conditions we can diagnose easily just by listening to a patient. But things that are common in the history are, chronic cough, something lasting more than 8 weeks. So if you just got acute cold and it lasts 3 days, that's not necessarily a sign of asthma. But if you've had a cough for more than 8 weeks, if, before you could walk a couple city blocks and now you're shortened down to 75 feet before you're getting short of breath, that's a change, and that might be an indication of COPD or asthma. If you are getting more respiratory or out of breath when you're even going up the stairs, those are all things you want to bring up to your doctor for attention. We know, based on evidence, that these things are on the rise. Here in the Coachella Valley, like it's already been mentioned, there's several thousand people suffering from these conditions. Within the United States, 65 million patients suffer from asthma, and it can occur at any age. So I'm borrowing these directly from HARC, so I did not come up with these graphs on my own. These are examples, though, the percentage of adults diagnosed with asthma here in the Coachella Valley alone. So in 2007, it was 7.9%, 2013, 10.1%. A little bit of a rise, but typically about steady numbers. That equates to about 35,000 adults here in the Coachella Valley alone that suffer from asthma. When we look at other respiratory diseases, and by and large these are COPD conditions, there's actually been a dramatic jump in the last 6 years, where you see 3.6% involved in 2007, 9.2% in 2013. So that number is almost tripled in 6 years' time, which is a significant number, and that equates to about 32,000 adults. Like I said, this can affect anybody at any age. So it's a good breakdown here, another graph that I borrowed, basically showing that it affects every age group. But I want to point out, a lot of times when we think of chronic, conditions, we think of the elderly. If you look at this graph, the elderly right here, it makes up about 20%. What's really significant is over a quarter is young adults. So, that's our college-age kids, people, young adults starting into the workforce, and a lot of them are affected by this. So what other effects does this have on our community? Like I already mentioned, I see a lot of these patients, especially around this time of year, coming into the clinics, coming into the emergency rooms and being admitted. Sometimes with severe asthma episodes, they need tubes placed to help the patient breathe in their throat. They have to go to the ICU. There has also been statistics that show that older patients that suffer from these chronic conditions require more assistance. They looked at statistics showing that on average, a patient without any respiratory disease, on average only needed extra assistance for activities of daily living. This is going out shopping, taking care of yourself. It's only around 4% for patients without respiratory disease. It's double that for patients with respiratory disease. When they looked at children, they looked at numbers to see how many days of school children were missing. Kids that had conditions like asthma, on average, were missing many days of school, which were affecting their education. In fact, they showed that there was about 4 times as many kids with asthma missing over 17 days of school per year compared to kids without those conditions. And that's because not only are they suffering from the condition itself, but then they have the doctor visits, if they get admitted to the hospital, all those things affect them. So a lot of these things we're discussing with these airway conditions not only affect your health, but affect your everyday life. And that's why it's so important, if you do think that some of these things are affecting you, if you have noticed your breathing changing, if you've had a cough, and especially it's common that that cough affects you more so at night, and it's been going on for more than 8 weeks, all reasons to come in and talk it over with your doctor. If you have asthma, or you know someone that has asthma, and they're saying their inhalers aren't working as much anymore, or they used to use their inhaler maybe once a month, and now are using it, maybe 10 or 12 times a week, that's not normal either, and that might mean you need to be on stronger medication. How asthma and COPD are typically diagnosed is it's a breathing test. So that exercise I had you guys all do to take a deep breath in, that's what we do in the clinic, and we evaluate and measure how much air you can blow out. And if you can't blow out a significant amount of air, or it's delayed in how much you can breathe, that might make the diagnosis of asthma, and it's important that we get you on medications that can help with it. Also important now that we're entering the flu season that we get those patients protected. Everybody should be protected against the flu, but especially patients with respiratory illness, because they can suffer much worse prognosis from that condition. So that's the end of my talk. So.
Let's save the questions until all 3 have gone, and then I welcome those. So, alrighty, thank you so much. And next, telling you a little bit about indoor air quality and how you can protect it and promote it. Ooh, am I starting from the beginning? I'm starting at the end. There we go. So Doug, take it away.
Thank you. Okay, so by a show of hands here, how many people do have asthma in this room? How about allergies? All right. Well, I'm going to start off actually just giving you a little bit of a personal story because I'm going to tie it all in together. I was a kid that was born with severe asthma. The doctors pretty much told my parents that I would probably die from respiratory collapse by the time I was 12 or so. It was very, very severe. And I was really lucky because my parents were resourceful, and I lived in Massachusetts. And they brought me up to Canada where they had medications that were legal there prior to them being legal here in the United States. So thanks to my parents' resourcefulness, I am here. I'm going to tie back to this. So a little bit about me. I'm an odd duck because I am an architect, but also my background is in public health. So my interest is the built environment because we often neglect the built environment in terms of our public health. We often run to the medical doctors, or we tend to run to social scientists, mental health counselors, but we often forget about the physical environment as a covariable within the whole epidemiological triangle. So that's a little bit about who I am. Let's talk a little bit about indoor air quality. So according to the EPA, indoor levels of pollutants might be as high as 100 times the levels as they're found outside. 100 times higher. And the EPA also says that we're spending an average of 87% of our time inside of the built environment. 87%. Do you know how much that is? That's a lot. And if you don't believe it, I tell this to my students. I tell them to grab a stopwatch, and I tell them to hit it when they go outside. When they get in their car, they got to stop it. When they get out of their car, they got to hit it again. When they get out of the car, they stop it. They go into the office. That's how much time we're spending inside of the built environment. And unfortunately, only 80% of children said that they feel uncomfortable outdoors. Children feel uncomfortable outdoors because they don't like things like bugs and heat. Interesting. All right, so What are we taking a look at? We do not have the first slide up. Underneath this picture here, which I can't get to, is actually a carpet on the outside of a house. So it's called a track-off system because the majority of our indoor pollutants are being brought in by our shoes. And so the Environmental Health Association has created a track-off system which consists of 2 different great light carpets that you wipe your feet off of prior to entering into the home. Once you're into the home, you also have another carpet that you wipe your feet off of. Now here in the desert, we have a unique situation. What is that uniqueness out here?
Sand.
Sand? That's definitely a uniqueness, you know. It's so dry. And when it's dry, we end up with stuff like this. When you can see daylight coming in through the doors or the windows, that's where you're getting your dust. How many of you guys have dust in your house? Yeah, we got a lot of that going on here. So when we take a look at some of these, things, we have to take a look at our ventilation systems and how the air is infiltrating into the home. As outdoor air comes on in, it starts to contaminate different aspects. This is a carpet. This is also known as a sink. Because what happens is with porous furniture that's very plush or carpeting, what happens is the dust and stuff settles into it. So now I'm going to tie it on back. So, there are 2 issues that we get concerned about as architects or designers. The first one is pregnant women. Because when women are pregnant, they inhale things called teratogens. These teratogens affect the developing immune system of the fetus. When they do that, that's when we start to see incidences like asthma or allergies and stuff like that becoming more prominent. My mom was tearing down a house when she was pregnant with me. She didn't know. She had no idea. So she was breathing in drywall. She was breathing in all kinds of dust. And no, there's no genetic links. I am the only person in my family, woohoo, to have asthma. I am unique. But I have been told by several people that there are 3 factors. One is your biology. Your biology, and pardon the euphemism, but I can't come up with a better one. Your biology is the gun. Your genetics is the bullets. The environment is the trigger. You have to have all 3. So, as we look at these types of things right here, when I was a little kid, I couldn't have pillow fights. I couldn't run around and jump on the carpet because it would cause an asthma attack, and we didn't have any of the drugs that we have today. So the best one that I had, and I still remember, was Allopent, and I remember squirting that thing like crazy, and I was immune to it by the time I was in 4th grade. So I was lucky that I went to Canada, and that's where I got Ventolin and Beclovin, some of those things that weren't legal in the United States at that time. So carpets become the sink. Now, guess where the most dangerous levels of environmental contaminants are? Right here. Yeah. Second level? Right here. Yeah. What do we do all day long? We sit. So, for those people that are over 6 feet tall, just stand up all day, you're in good shape. Why do I say that? Well, we've got a couple things happening here in the valley, and we've already seen it in cities like Fresno, which has ridiculously high asthma rates. As we degreen the desert, good, bad, or indifferent, it's up to, whatever your political views are, yours. But as we degreen the desert, it means that more of those particulates are going to become airborne. Grass is something that holds everything down, and it causes an infiltration. So as we degreen the deserts, and the second thing happens, which is what? Drying up of the Salton Sea. We're going to start to see more and more dust things, and as we just saw only 2 years ago, do you remember the color of this?
Yes.
Rotten eggs, kind of? What did it smell like? Climatologists have already said that we're expected to see more and more of these haboos come through. That's our air quality. That's what we're breathing in. That's what our pregnant mothers are breathing in. That's what our children are breathing in. That's what we're breathing in. And that's me.
Who will be speaking, and he's going to give you a little bit more details about outdoor air quality, because as Dak mentioned at the end, indoor air quality isn't the only problem. There's also the issue of outdoor air quality. So please welcome Mr. Luke Klein.
Thank you very much.
And Mr. Luke Klein is from the gas company, which is our lovely sponsor for tonight. So double thank you.
Yeah, thank you. My name is Jared Klein. I'm a senior public policy advisor at the gas company. And besides giving presentations, I do analysis on legislation and other regulatory ideas. So, California, we have a problem. You know, clearly we have an air quality issue. You know, that's the best example of that is the two air districts with the worst air quality in the nation reside here. It's both the South Coast and the San Joaquin. You know, so what's causing it? You know, one of the big reasons that we have it's transportation. You know, 80% of the region's smogs or NOx, which is nitrous oxides, are the reason that, you know, that we have this bad air. In addition, transportation also is about 40% of the GHG emissions here in California. You know, so what causes this? What's the big reason why? Well, one of them is heavy-duty diesel trucks and also heavy-duty gas trucks. These are the 18-wheelers that you see going by on the 10. These are the big trucks. I think the stat is they make up about 1% or a very small percentage of the total transportation, but they make up about 40% of the nitrous oxides here in the state. So what can we do about this? What's the solution? Well, the gas company, in conjunction with the CEC and the South Coast AQMD, and Cummins Westport, has come up with a near zero emission game-changing engine. This is an engine that runs on natural gas. It's 90% cleaner than the current diesel trucks. And it's a game changer because it's called, and we didn't come up with this word, it's called power plant equivalent. So essentially the engine produces as much emissions as a power plant creates while powering an electric vehicle, or specifically in this instance, an electric truck. And for those of you who are concerned that, you know, this is a fossil fuel, about 20% of the natural gas that goes into the transportation sector currently in California is renewable natural gas. Renewable natural gas is that kind of gas that comes from methane, whether you can get it from landfills, you can get it from dairy waste, you can get it from wastewater treatment plants. Essentially, you take the raw biogas, you condition it, you put it into the pipeline, you can use it for transportation, you can also use it as a decarbonized gas for cooking and heating and other forms, and as well as in industrial uses. So, in addition, you know, to just cleaning our air, you know, this natural gas engine also helps us meet other goals. You know, it can help reduce petroleum by 50% because natural gas is not considered a petroleum fuel. When running on renewable fuels, it can reduce our greenhouse gases, and it can also, like I said before, it's a 90% cleaner engine than the current diesel standard right now. And I don't want to pick on diesel, and certainly I'm here, you know, I work for the gas company, but, you know, we're talking about meeting a .02 standard. If diesel can meet a .02 standard, so be it. The thing, you know, when an electric heavy-duty truck comes available, so be it. You know, but they're having issues with batteries, and according to ARB's own tech assessment, those are 25 to 30 years away. So, from our perspective, is why wait? You know, let's get into this game now. You know, we're suffering. People are getting sick. We have an engine available. The 8.9 liter is out. That's the same kind of engine that would run a heavy-duty transit bus. The 12 liter will be out hopefully in another year. And that's the kind of truck that will move the goods. It's the big 18-wheeler truck. And so from our perspective, you know, we need to get these out. So how do you do it? It's an expensive truck. and it needs incentives. There's no doubt about that. It's a new technology, and like all new technologies, it needs some help from the state. So we're advocating at the state level, at the South Coast level, for funds for these trucks, and I think it's starting to be heard. We're sort of moving the needle in terms of changing the conversation. For a lot of years, it's been about electric, electric, electric. We've come in, we've presented a different option, and rather than having technology mandates, we're advocating performance standards. Let's set a performance standard. If you can meet it, you should be eligible for it, and you should be able to be involved in the game. So from our perspective, we need incentives. So where are we getting that? The big pot of money here in California is greenhouse gas reduction funds. This is the money that comes from cap and trade. It's the money, we're all pitching in about 10 cents a gallon right now. So that's also the money from the biggest polluters in the state. The state basically takes it all out, aggregates it, puts it into a pot. 25% of it is going to the governor's bullet train. So we're trying to get a piece of that money. And we're having some difficulties, but we're changing the conversation, and hopefully we can be productive in this next year. Thank you.
Thank you all so much for speaking. But now I know is the part of the night that is most interesting, which is Q&A. So my lovely director of research, Dr. Casey Lear, has a mic in the audience. So if you do have any questions, please do raise your hand. Casey will come bring you the mic, and you can address them.
My question is about indoor air quality. When you go to Home Depot, and it doesn't matter if you're a renter or an owner, everybody has an AC unit in their house. And when you go to buy filters, you see 3 or 4 different kind of rating systems, and it's very confusing, and I'm trying to figure out which is the best rating system to go by when you're buying your filter. Are you going by HEPA? Are you going by some other standard that other companies have put on their products?
Well, you can go. There are 2 different. HEPA's definitely good. It's certified by the Asthma and Allergy Foundation, and they're the ones that usually will get up to 98% of your particulate matter. For the more industrial stuff, there's a MERV rating that would come into play. And again, you want to look to see what's going to get the smallest particulate matters. The big issue with the air conditioning is that people don't clean their filters as much as they should. I'm a big fan of doing it at least twice a year. It's my spring and fall cleaning.
I was so surprised to know that indoor air quality is worse than the outside, because I keep my windows closed all the time, and I use a HEPA filter and a humidifier, because I'm thinking, okay, I'll keep everything clean inside my house. And you're saying that it's worse inside? Why is that?
It's worse mostly because of the way that they do their measurements. It's particles per billion, so there's a smaller concentration. So if you think about the total volume of air that's in your house versus the total volume of air that's outside. But the other factor is that we have a lot of materials within our environment that has a slow decay. So if you just take a look at that carpet that I showed you, and if you were to run your hand along it, you would end up with those little fibers. Well, those are things that you can actually see. So there's a lot of stuff within the built environment that has a natural decay rate that will increase the contaminants within the built environment.
Oh, this is fantastic. No, I have my nephew, is my twin sister's son. He's like in his 40s now. He's always suffered from asthma, and he's almost died a couple times. So, it's very interesting to find that out. I guess you can be born with it. That's a part of to you, sir. That you can be born with it, huh? And it's like food allergies too, or something?
Well, usually we'll see a constellation of symptoms. So there's folks that are more more inclined to it usually have something called atopic disease. So a lot of times we'll see in a triad. So folks may suffer from asthma as well as eczema and then allergic rhinitis or the seasonal allergies. Because there's a lot of times folks have allergic triggers to the asthma. I like the example of the gun. I thought that was perfect. I'm going to actually steal that and use that in my own clinical practice because I think that's a good way to describe it. But there can be children that are born with compromised respiratory states, oftentimes premature children whose lungs may have not developed fully before they were born, or children that may suffer an early infection. One example is the respiratory syncytial virus, or RSV. You may know or had a child that suffered from RSV. My niece did. She was a preemie. She had RSV, and now every winter she gets a bad, well, my sister calls it bad cold. My suspicions are, through conversation with her, that she may have a mild form of asthma, that every time a cold kicks in, her lungs are compromised by that, and it's a milder form of a possible longer-term condition like asthma.
And something else related to me, and I think other people can relate to it. All my life, you know how you end up getting a cold in the month of December, even though you don't want it, but it just happens? Well, as I've gotten older, because I'm almost 67 now, I don't seem to get it anymore. And I used to suffer with terrible bronchitis. And so thank God it's not there anymore. I didn't think I could outgrow it. So that does happen, doesn't it? Again, it's happened to me.
Sometimes you can build up certain immunities. Oftentimes, folks that have compromised medical states that have lots of long-term conditions like heart disease and high blood pressure, your immune system can be compromised as you become older. Sometimes if you've been exposed enough and maybe not in the same circles, you may be more protected. I use the joke because I have 4 children. I live with 4 walking petri dishes because they go to school, they go to daycare, and they bring everything they collect at school and daycare back home to me. Sometimes you can be protected in the environment you're in, but every year people are at risk for the flu, every year everybody's at risk for new viruses, and for those folks with respiratory disease, it does pose a great risk to them.
Yeah, and I don't want to be selfish, but you hit it. You're so right on. I was taught by my mother and my dad. My mother used to make a joke because she's from Russia, so it's close to China. We take our shoes off and we wipe our shoes completely before we put them back in the closet. And that's what we do to control bringing in the things. And less carpet, the better. I like the floor. It's easier to keep clean and I think less bacteria. So I totally agree with what you're saying. And I'm so delighted that your parents were so insightful and obviously loved you so much to move to Canada, and that you were very lucky to have the medicine to bring you to us today, because you have so much to give to society. And I thank you for sharing what you shared today.
You're welcome. They didn't actually move to Canada. We just kept driving up and down the coast because we're from Massachusetts. So we would just go up to Montreal. But yeah, that's where my doctors were. But yeah, kind of going back to the woman up at the top there who had asked about the indoor air quality. That's a big portion of it, is how much that we actually bring in, and do you allow people to walk around your house with shoes on? And it's interesting for me to hear some of my clients, and they'll say, well, I don't want people's bare feet on my floor. But the bare feet is actually better for you, ultimately. And if we can reduce some of those fabric base within, then we can start to decrease some of those sinks, which is what we're really worried about.
Especially when you have construction, they won't take the shoe off, they have to protect themselves, but you have the booties.
Right.
That helps.
Well, and the compounding factor is that when you have dust introduced, then you bring in the dust mites. The dust mites have urine and fecal matter, and then they die off, and so then you have your carcasses. So, I mean, it's a whole system that comes into play, and so when we do environmental analyses for how to keep the environment cleaner, that's part of what we do.
A big thank you to Seth and Cal, what you have shared, and thank you for your generosity for feeding us tonight. Pretty cool, huh?
You're welcome.
Thank you.
So my question is, how does the Coachella Valley's air compare to other cities in California and then nationally?
Well, so the Coachella Valley is part of the South Coast, and the South Coast is currently one of 2 areas that are currently in non-attainment, meaning the air quality is so bad for a certain amount of days. There's only 2 of them in the nation, and so I think there are two goals. You have to be at 80 parts per billion by I think it's 2023, and then 75 parts per billion by 2032, and we're currently not anywhere near those. And so the Coachella Valley, if you go to the South Coast Air District, they have a map. You can look at it. It's generally about the same as, I'd say, Riverside and all the way into LA. It's usually moderate. Very rarely does it get into the good area, and some days it can get into very poor. But in terms of relativity to the rest of the country, it's very bad. And I believe there is one air district in Texas that is near non-attainment, but it's not there yet.
And then the follow-up to that, what is it that's causing it? What are the particles? Is it the agricultural here, or is it pesticides or things from golf courses, or?
No, it's mainly transportation. It's primarily transportation. 80% of the NOx, which is a precursor to ozone, which is basically smog or haze, is caused by transportation. It's caused by light-duty vehicles, medium-duty vehicles, heavy-duty vehicles. And it's basically us traveling from point A to point B. So one of the ways to clean this up is to clean up the transportation. Electric cars for light duty makes a lot of sense, assuming they can figure out range anxiety. In the medium duty and in the heavy duty, a combination of fuel cell and natural gas makes a lot of sense. So that's basically we're going to have to deal with the transportation issue, and it's a big one. It's going to cost a lot of money too.
Is there an app that you could recommend for a mobile device that gives good reports on the air quality in this area?
So the South Coast AQMD website has, I don't know if they have a mobile app, but if you just go to the website, I checked it actually before I got here. They have a map. It just clicks a map, and it has an overlay of the whole South Coast and the air quality within the South Coast. It's the South Coast Air Quality Management District.
Actually, I could ask you that. If you go to the iTunes Store or Google Play on your smartphones, look up South Coast HUD, there's an app right there. You type in your zip code, and it'll track air quality for your zip code.
And this is one of our speakers for our Spanish session who happens to be with the Air Quality District. So he knows.
Oh, sorry to jump in here. Just adding to the comment that if one goes to the iTunes Store or to Google Play, you can download South Coast HUD app. Among other things, tracks air quality in your area by zip code. So that's available to you. Load it up on your phone. You can check every day, and it'll give you the guides.
Regarding the internal air quality of your house, what do you think of devices that they sell in the hardware stores for like a filter system that you plug into the wall, and it's supposed to clear the air in your house of particulates?
I think that the significant issue with that is what is the radius around the device itself that they're able to bring in air. We've done some sampling as part of our program, and we have found that when you start moving further and further away from the device, the ability of the device itself to clear the air, it becomes lower and lower. And if you put in the necessary devices, the number of them, it starts to sound like a jet engine in your home, which is many people find disturbing. I think that there's a lot of things that you can do with building materials and with the design that you can reduce a lot of that, and with a good cleaning pattern, I just think that that's a better way to go.
And also I know the air quality indoors is worse than outside because of the chemicals that we use to clean it, to clean our house, to keep it clean.
Without a doubt.
Right?
Without a
Can you
doubt.
tell us more about it?
That's more of the aromatic hydrocarbons, which are the chemicals that we breathe in, which have been traced to a lot of cancers.
So to follow up on that, what would a better alternative for the cleaning supplies be?
There's a lot of websites that you can go to that'll take a look at the natural vinegars, for example, is something that you can use. Just go to My Healthy House, which is online, and it'll give you some of the more organic or the natural devices that you could use.
First, I just wanted to ask quickly, remember people were always moving to the desert for with breathing conditions. You know, wasn't it before that everybody used to come here because they wanted to get rid of their asthma and things like this? I thought that was a thing in the old days. People used to move here for that. Have we changed so dramatically in recent years that that's just opposite now?
Well, I'm not really sure what the trends are in terms of people moving into the desert. I do know that in areas like Phoenix and Tucson, I haven't looked at this area, they're having some of the same issues that Fresno has, which is the accumulation of the pesticides and the organic materials that are sitting on top. Because if you go to someplace like Wisconsin, for example, where you've got a lot of rain and grass, and they have a high dew count, what happens is that at nighttime that dew pushes all the particulates to the ground, and then because of the way that trees and grass respirate, it tends to stick to them. And if you want to do this just in your own example, just find a tree that has a leaf and pull out the leaf and then rub it, and you can get the particulates onto your fingers. It's because the sap is holding on to it. So as we lose that stuff, all of that sits just on the top because we don't have anything that's causing it to filter into the soil. So when we start to get the winds, it starts to come up, and it tends to be right at the breathing zones. That's why the haboodins look the color that they do, because a lot of that is just pollutants.
And then just quickly, I wanted to ask Dr. Domagowski about when is a cough something a person should worry about? I'm hearing people talk about that are my age and mid-50s and things about sounding like people with COPD. And are we getting that? And what do we look for?
Yeah, so I would usually advise, and I kind of alluded during the talk, was if it's just a general cough and it's, with other symptoms of a common cold, especially around this time of year, and it's only, 1 or 2 weeks, that's nothing. If it's anything persistent, longer than 8 weeks, that's definitely time to go talk to your doctor. If it seems like it has any provoking symptoms, like it always comes on at night when you're lying down, now, you can get that post-nasal drip from a cold, and that will cause you to cough at night. But a lot of times in the asthma patients, in young children and adults, their symptoms will get worse at night, and that's usually, that's a historical factor. Other things to look for is the limitation in your breathing. So, obviously, if you have an audible wheeze, that's not normal, and that's an indication that you may be suffering from COPD or asthma.
And are coughs with phlegm more like allergy rather than COPD kind of thing? If they don't have that breathing problem, really, but it's just...
Not necessarily. So a lot of times when we're back in medical school or we train our residents, we talk about the different forms of COPD. So bronchitis, oftentimes you will have phlegm production. So if you see those commercials with the little mucus family living in lungs, that's bronchitis. So that can be a chronic condition associated with COPD. A large risk factor for the development of chronic lung disease is cigarette smoking, but because of the changes in our environment and the pollutants now, I have patients in panel to me that have conditions like emphysema and COPD that have never picked up a cigarette. So it can be caused by other things, and that's why we have to be on the lookout for it. So I would say if you have a chronic cough that's not getting better, your breathing is compromised, those are times you want to present to your doctor and see about those additional breathing tests that they can do.
Just an observation. When I was growing up, and I grew up in a Southern California native from the San Bernardino area, and we used to have every few days, it seemed like, we would have what we would call a small wave. And they would talk about it over the news, they would announce it, and they would suggest that the kids not be let outside to go play. If it was, sometimes if I remember it correctly, even if at school, if the smog alert came along and we were encouraged to stay inside, our teachers would let us do puzzles and things inside. And I had asthma then too growing up, and then suddenly I didn't have it anymore. And we moved into the desert, but from what I see in the air quality and what you gentlemen have presented here today, is somebody just not telling us that the air quality is as bad as worse? Should we be getting alerts now? Do we get them now? Am I missing something?
I think the air quality has improved significantly since, because I remember when I was in school as well, I had those smog alerts as well. And so I do believe the air has improved, and I'm not an expert on air quality issues. I believe the gentleman up there probably can articulate it better, but I don't believe we've gotten those smog alerts as of late. I don't remember hearing them as well, and I think that is part of a lot of what the South Coast has done in terms of air quality management. It has gotten significantly better, but we need to continue to improve.
And like the Inland Empire, where she was referring to, and LA Basin area is comparable to the air quality here?
I think that would be dependent upon the day, and I believe he wants to answer that.
Guillermo, why don't you introduce yourself?
Hi, good evening. My name is Guillermo Sanchez. I'm with South Coast State QMD. In response to the last couple of questions, the good news is there have been no stage 1, 2, or 3 smog alerts in the region for many. Fortunately, even with the vast improvement, challenges remain, and nationally, us in the San Joaquin Air District, continue to have the worst air quality in the nation. So we've come a long way. We have a long way still to go. And as they study more and more, and as they update the standards, those standards are health-based. So the more we study, the more we learn about the impacts on the human body, as well as we learn what's achievable. Those standards are getting tighter every 3 to 4 years.
Would a lot of that, the South Coast pollution be related to the Inland Empire and LA Basin area?
Those comments are generally true. Now within the South Coast Basin, which covers Riverside, San Bernardino, Orange County, Riverside, San Bernardino, Orange County, Los Angeles County, collectively we have the worst. And then unfortunately, out here in Riverside County, Coachella Valley, it's actually worse by and large. Our cancer toxic rates for Coachella Valley is less than for the rest of
the future. What is the one thing that you would recommend that our audience does?
For the health piece, I would say if you do suffer from a chronic cough, if you have noticed your breathing being compromised, if you have noticed, it's affecting, either your activities around the house or the activities you used to enjoy, I definitely would go seek out your family physician. It doesn't have to be a pulmonologist or a lung specialist. You can come see a family physician or your medicine doctor and discuss it with them, or if it's affecting your children, find a pediatrician and have them tested.
Well, probably the most cost-effective one would be to take your shoes off once you get inside the house and make sure that you have some wipes there. If you got a little bit more money, let's start redesigning so that we can get rid of some of those things within the house.
Mass transit is always a great option. It's good for the environment to a degree, and the other thing you could do is you could advocate or join a group to advocate for policies that create cleaner air.
That also brings up the idea of active transport, which is bike lanes, riding your bike to work, which is entirely friendly for the environment and also good for your health-wise as well. All right, well, thank you very much to our speakers. Give them a big round of applause. And they will be in the lobby for another few minutes if you have some extra questions.